COVID-19 pandemic remains severe. We are seeing increase in cases. In the past 6 months, we have seen the doubling of confirmed cases. As at yesterday, there are 16.8 million cases. And I think by today, it's got surged beyond 17 million cases, and there were 60,000 deaths. The second point I must make is that any effective vaccine is still under development. So this virus not go away until there is an effective vaccine that's put to mass production, so that the vaccine could be used widely around the world. Only then could we say we are safe. So that's why all governments have to take effective measures to prevent the pandemic from spinning out of control. Many experts have given advice to various governments and peoples. That is, if we are to follow these prevention and control measures, then we could reduce the number of infections. But if we let down our guard, then infection numbers will go up again, because at this point in time there is no effective way to eradicate this virus altogether. Now, if you've attended many press conferences we've held, you will know what we've been doing in Hong Kong. Now, all along we have adopted a two-pronged approach. On one hand, we try to reduce the number of cross-boundary arrivals, and second approach is to adopt social distancing measures. We also adopt the suppress and live strategy. That is, we will adjust the relevant policies in a timely manner in the light of the latest public health situation, the economic needs, and also public acceptability. I've tried to demonstrate that, illustrate that in graphics, three-person tug of war. So it may not be entirely scientific in making decisions that involve certain judgments. And we have seen that by now how the public have reacted to all these measures. And a third measure we're taking is to do contact tracing, but unfortunately there are still many cases of unknown sources of infection. The fourth measure we're taking is, of course, to step up testing. Now, at the CHP, the hospital authority, at various clinics, and even for high-risk groups in the community and places where we have seen a high number of infections, we have stepped up testing in these places and among these groups, so that we could achieve early detection, early isolation, and early treatment. Of course, if we do more testing, we would need more facilities. So our strategy has always been to also provide more quarantine and isolation facilities and testing facilities as well. And then we've also been mounting extensive public education effort, so that members of the public will observe personal and hand hygiene, and as well as environmental hygiene. And then we have taken strong measures to try to reduce the number of arrivals. Now, in February, in January, on average, there were 325,000 arrivals in Hong Kong by air, on land, and by sea. And then by this month, the numbers dropped to 2016, and most of them are Hong Kong residents. It's probably some students or others who went overseas. They have to come back, and also there may be people who are involved in sourcing and procurement. They have to travel, and so they have to come back too. And then for people leaving Hong Kong, now, especially Hong Kongers, if they leave Hong Kong, say, to go to the mainland, they will have to come back sometime. So that's why we try to also reduce the number of people leaving Hong Kong. In January, the number every day was 320,000, and now we've suppressed that to also just about 2,000. So you see, there's little room to reduce the number of arrivals and departures, unless we are saying that we will disregard the freedoms and rights of Hong Kong people to travel or to enter and exit the territory. But if we do so, it will be a very harsh measure, and there could be legal challenges. And then on the social distancing, we adopt a suppress and lift strategy. Sometimes we tighten up the measures, sometimes we relax the measures. For example, the cap on group gathering size, class suspension, closing certain scheduled premises, mandating the wearing of masks, or forbidding visits at hospitals and residential care homes and so on, to try to avoid cross-infection. But then starting from about the 8th of July, we have seen a serious outbreak. From the 8th to the 30th of July, there was an increase of 1,852 cases. And then before that, there were 1,300 cases in the past 6 months. So we're seeing an increase of 40% in those 20-plus days. And then we have recently seen a single-day high of 149 cases. 90% of these cases involved local infection cases, and as I said earlier, close to half of those confirmed cases have unknown sources of infection. Of course, we'll still try to do tracing. Hopefully, we could identify the close contacts and also the source of infection. And what is most worrying with this outbreak is that it involves the different groups, different types of workplaces, and different districts. Now, almost we have seen almost all kinds of trades and occupations where there are confirmed cases. Also, we are very worried about infections in residential care homes for the elderly and so on. And before that, we were already expressing concern about possible infections at residential care homes for the elderly, but we managed to stave that off. But now we've seen outbreaks at various residential care homes. And then, so we're seeing this epidemic, which is really severe, but then we're not seeing any signs of the epidemic easing. Now, if we say that at the beginning of the epidemic it was the first wave, and then there was a second wave of infection caused by imported cases, and now we're in a third wave of transmission involving mostly local cases. You see that between April and July, the epidemic became stable for a while, and so various businesses were able to resume, and then classes were resumed, and then we managed to hold the DSE successfully. So it's under the suppress and lift strategy that we were able to allow the community to go back to normal to a certain extent. But then starting from the 8th of July, we're seeing a spike in local infection cases. Of course, we've seen some fluctuation, but then it's been 10 straight days where we have over 100 new confirmed cases every day. So this is really severe. This map shows you that infection cases are all over the territory. At the beginning, the clusters were mainly in Kowloon East. Now, Kowloon East cases still account for about 1/3 of all the new cases, but then you've seen that there are now cases all over the territory. So the overall assessment is that since January 2020, the epidemic is now at its worst, and we will see continuous spread in the community, and there is an increasing risk day by day of a major outbreak. Now, by doing more tests, we will be able to detect more infection cases. Well, actually, at the daily press briefing of the Center for Health Protection, you would recall that often questions were asked. That is, for, say, high-risk groups like taxi drivers and employees of residential care homes, we we have done many tests, and then we found asymptomatic cases. And these people were infected without symptoms. So these are the silent carriers. So how many more silent carriers are there in the community? That's something we need to tackle, but it's a major challenge. The first point is that many are expressing concerns that our public health care system may be overwhelmed, and hospital authorities are already overwhelmed, and that's why many infected patients are not able to be admitted at the first instance. We must apologize for that, and we are doing our very best to speed up the process so patients can be admitted into hospitals for treatment and isolation. But if, say, this outbreak continues, it will actually pose a threat to our public health care system. So, on the whole, the epidemic has posed a serious public risk to Hong Kong. The second part is about the impact of the epidemic on the election. Now, the election in Hong Kong is unique in certain ways. This is the Legislative Council General election. This is actually the biggest election of all elections that are held in Hong Kong. We have as many as 4.4 million registered voters, so all of them could come out to vote. And there are 70 seats, so we will see keen competition. On the day of the election, we have to set up 615 polling stations across Hong Kong Island, Kowloon, and the New Territories. We need to recruit 34,000 staff members to help with the election. These workers will work at various polling stations. They may also be sent to the Central Counting Centre and Media Centre, and there will be a large number of people gathering, and there will be much human interaction, so it poses a great risk of infection. Another unique feature of the election is that many Hong Kong residents live on the mainland. They come back to Hong Kong every day because, for people living in the Greater Bay Area, it's easy to come back to Hong Kong. And then there may be some Hong Kong residents who have families here, but then they have to go and work on the mainland, and they come back from time to time. And every time when there's an election, these people are happy to travel back to Hong Kong to cast their vote because they care about Hong Kong. And then many have been stranded. At the beginning of the epidemic, we had to arrange charter flights to bring back stranded Hong Kong residents from, say, Hubei province, Pakistan, and other places. So I believe there are still many Hong Kong residents stranded on the mainland and overseas. But then, as you know, we have taken measures to reduce the number of arrivals and departures, so it seems impossible for these people to come back on the 6th of September to cast their vote. And the third consideration is that now we have the strictest group gathering restriction. That is, a group cannot be more than 2 persons. So that's why many activities could not be carried out, or in particular in relation to electioneering, for example, visiting members of the public or staging street stations. So these cannot be held. And then we have a central counting centre, say the district council second constituency. All the votes are taken there for counting. I understand there are close to 10,000 workers at the central counting centre, and then there will also be a media centre. The original plan is to put these 2 centres at the Asia World Expo, but then you've been asking the hospital authority every day when the Asia World Expo could be turned into a community treatment center. So therefore, it won't be possible for us to put the Central Contact Center and the media station at the AWE. We have to find some place else. Now, we are to do it in such a short time, that is to find the right place, and also to do training. It will be a major challenge. And also, the fifth consideration is that this epidemic affects the elderly the most in terms of the infection risk or the fatality rate. But then in our voters register, there are some over 600,000 elderly voters. Now, they're going to face additional risk because of the virus. Probably, therefore, they may not go out to vote, or their family members may not want them to go out to vote on the day. And then there's another point which is also unique to Hong Kong. Now, under the existing legislation, it is not possible for us to make other arrangements for other places for holding the election. For example, if there cannot be any election gatherings, then can we do publicity, say on TV or radio? Well, some places allow that, but in Hong Kong we don't allow that because we don't allow any advertisements to be of a political nature. And then it's not possible to, say, stage the election over several days instead of on just the 6th of September. Also, we do not allow people outside of Hong Kong to cast their votes. We don't have electronic polling, and we don't have postal polling, and so on. Now, this is what you've seen last time, say, at the district council elections and in the 2016 LegCo elections. You see this large number of people gathering, and people coming into contact cannot be avoided. We're talking about over 3 million people all coming out on the same day. This kind of scene could not be avoided. And third part, let's talk about the experience of the elections being postponed in other places. Because some who have voiced objection to deferring the election say that in other places they managed to hold their elections. Well, why can't we do it in Hong Kong? Well, we can look at two sets of statistics. The International Foundation for Electoral Systems, as at the 15th of July, 62 countries and 8 territories had to postpone their elections because of the epidemic. There's another international organization, that is the International Democracy and Electoral Assistance. From the 21st of February to the 26th of July, there were at least 68 countries and territories that had to defer the elections because of the epidemic, and 49 countries and places managed to proceed with the election. So you can say there are more countries or places deferring the election rather than proceeding as scheduled. I must quote a particular example. You're familiar with the UK. On the 25th of March, the UK passed what is a piece of emergency bill. There's the 2020 COVID-19 coronavirus bill that includes postponing an election. Now, on the 7th of May 2020, 118 district bureau elections and also the city mayor elections of 188 places, including the election of the London mayor, was postponed to the 6th of May 2021. Another place that's familiar to you is is Australia, New South Wales. Originally in September, there would be a series of district elections in September, but again, similarly, it's deferred to September the following year. That is postponed of 1 year. And then we have looked at overseas experiences now, and then in Hong Kong, we have following justifications for deferring the LegCo election. That is, on the same day we will have, let's assume the voters turnout rate 70% or even higher, then we're talking about over 3 million voters all going to 615 polling stations across the territory to vote on the same day. You would know, of course, those polling stations aren't large in size, and there is not much space outside polling stations. So we're talking about a large number of people gathering, and it will lead to an immensely high risk of cross-infection. And now, let me tell you the views of the Electoral Affairs Commission on the election. But I must stress here, we have not had any discussion with the Electoral Affairs Commission on this matter. And so 3 days ago, the chairman of the Electoral Affairs Commission, Mr. Barnabas Fong, wrote to me, that's on the 28th of July. Now, why didn't I discuss it with him? Because this is a decision for the government. It's for the government to decide when to hold the elections, and then the EAC will make all the arrangement. And if we are to defer the election based on public health risk, then again, it's the government's decision. Anyway, I would like to thank Mr. Justice Fong and his colleagues for their detailed consideration. He wrote to me on the 20th of July, and he lists out the public risks and health risk involved if the election were to go ahead on the 6th of September. Now, so this is extracted from his letter. He also expects a high voter turnout rate, so many of the polling stations will not be able to follow the requirements of the Center for Health Protection to maintain a social distance of at least 1 meter, not to mention 1.5 meters. And then the registration and election office estimates that for 30.9% of the polling stations, they have to serve 4,000 to 8,000 voters. And then for 45.5% of the polling stations, they will have to serve between 8,000 and 15,000 voters. So, as I said, this may lead to a high risk of cross-infection with that many people gathering together at the same time. And also there are people under mandatory home quarantine. And the EAC is of the view that it's hard for them to make arrangement for the home confinees to vote at a specific time in a safe manner without causing infection. So that means that they will have to set aside a certain period for these people to vote, and then they have to do disinfection and so on. It would be challenging. And then I mentioned the central counting center. You know, there are several, or even polling stations. You know, there are several staff members sitting together to give out the polling papers, and then the ballot papers, and then it will be hard to maintain a distance of 1 meter between staff members. And as I said, for elderly voters, they have a much higher risk of infection by several times than compared to other people in other age groups. So if they come out to vote on the day, it may be a risk to their health. So the EAC's conclusion is that if there are over 3 million voters coming out to vote, it will lead to exponential risk factor. That is exponentially high infection risk. So they would like the government to consider whether the election could still be held in safe manner on the 6th of September. Now, apart from these reasons, of course, we see other reasons as well that I've explained them earlier briefly. Now, there is at the moment a group gathering ban of no more than 2 persons, so therefore candidates are not able to carry out any election gatherings. Now, when UK decided to postpone their elections, this is one of the considerations as well. The UK also has something of an electoral affairs commission. Their electoral affairs commission advised the government that if the candidates could not garner support or during the election, it would be unfair. And then, as I mentioned, there are a large number of voters living on the mainland, or working there or learning there, and there are many others stranded overseas as well, and they won't be able to come back to exercise their right to vote if the election proceeds. And then for elderly voters, there is a high risk of infection. If they got to vote, they will have to take this additional risk. But then if they don't go out to vote, then again they won't be able to exercise their right to vote. So having considered all these factors, we believe that if we proceed with the election as scheduled on the 6th of September, we would not be able to meet the requirements of an open and fair election. And also, this could pose risk to the voters, the candidates, staff at working polling stations, and so on. So if we postpone the election, for how long should we postpone it? Now, we have looked at the information compiled by the 2 international organizations. Different places have different practices. Some would have deferred their election by a few months or by a year, and some have push back their elections indefinitely, because that is, they can't say when they should do it. Now, the Executive Council has made the decision to postpone the election by 1 year. These are our considerations. The first consideration is, of course, public health consideration. The new wave of transmission may go on for several weeks or even longer, as you have heard from the experts. And then, from my experience in April and May, even when the epidemic became stable, it would take several weeks, at least, for the community to go back to a more or less normal way of life. And experts have warned us, advised that unless there's going to be an effective vaccine, otherwise there may be another outbreak in the summer, in this winter at the end of the year. Now, just now at the 4:30 daily press briefing, a reporter asked Dr. Chong Shuk-Wan how we're getting prepared for a possible outbreak in winter. And another consideration is that the Legislative Council is an important organ. It has a constitutional status. It has powers in passing legislation, vetting government spending, and approving the budget. And there is an annual cycle for these various tasks to be carried out, especially in relation to the budget. So you can imagine, say, in February or April, the Legislative Council cannot pass the budget, then the whole government will be affected, and all government-subvented organizations will be affected too. So, if there are uncertainties in the Legislative Council general election, we cannot allow for a vacuum in LegCo operations. Now, if we cannot hold the elections on the 6th of September, and we want to push it back, it would take at least 3 to 4 months to prepare for the election. And then, to be fair, before the next election, we should launch another voter registration exercise. So for those who have become 18 years old, and for others, they are given a chance to vote to register as voters again. So that means we need to go back to the same cycle. It will take some time to do that. And another consideration is legal analysis. Now, there are some from the legal profession, some who are not legal professionals. They have looked at all the relevant legislation in Hong Kong, see which is relevant. Now, of course, CAP 542, the Legislative Council Ordinance, is the one directly related to the Legislative Council. And then we have done a detailed analysis of the Legislative Council Ordinance. It won't allow us to postpone the election by 1 year. And also, it won't allow the current Legislative Council to operate as normal until the next LegCo general election. Now, in Section 44(1), the Chief Executive is given power to direct the postponement of a general election if before holding the election the Chief Executive is of the opinion that the election is likely to be obstructed, disrupted, undermined, or seriously affected by a riot or open violence or any danger to public health or safety, that could give direction for the election to be postponed. And then in Section 44(4), if the Chief Executive directs the postponement of the election, it cannot be pushed back by more than 14 days. That means if we do not hold the election on the 6th of September, we must do so by the 20th of September. And it seems that with the current epidemic, that's not something we can do. But the people may say that you can keep then extending it, the direction by 14 days at a time. But if the Chief Executive does so, people definitely will complain that the CE is abusing a power, and definitely that will lead to legal challenge. And then there are others who have suggested that perhaps we put several provisions together and then we could achieve the effect. For example, under Section 4.2, the Chief Executive to use her power to designate the commencement day of the next term of the Legislative Council in the following year, not coming October, because it's not been gazetted. So some say that the Chief Executive could then say the commencement of the LegCo will be in 2021. And then under Section 6(2), I have decided that the election be held on the 6th of September, so I could rescind that direction. And then in accordance with Section 11, That is, I could request the President to convene an emergency session. That's Section 11(1), and then under Section 11(2), if the President convenes an emergency session, then persons holding office shall be deemed as members of the Legislative Council and they continue to handle business. Now, of course, if we do so, this is not the original intention of these provisions, and again, it will lead to legal challenge. And of course, you're familiar with Cap 599, that is during an epidemic. The Chief Executive Council has relied on the Prevention and Control of Disease Ordinance, Cap 599, to enact various regulations to protect public health. But having considered or studied these ordinance, now one of the purposes of postponing the election is also to ensure that the elections can be held in a fair and impartial manner. So it's not just about public health issues. That's why Cap 599 does not apply. Now, because this epidemic is a public health emergency situation, therefore we decided to invoke Cap 241, that is the Emergency Regulations Ordinance. Why is it that we are now in a situation that endangers public safety? Because we're seeing a spike in infection cases and number of deaths. If we have an election leading to a large number of people gathering who will come into contact with each other, that could pose a serious public health risk crisis, as I explained earlier. And also the nomination period ended today. Definitely then candidates are going to start their electioneering activities. And we'll be seeing an increase in such activities. So you can imagine, therefore, many would be asking this question for the 3 million plus voters or voters stranded overseas, including the one who wrote to me. Now that voter is stranded on the mainland. The voter said that if I proceeded with the election, then the voter may seek judicial review. So everyone knows that we are to have the election on the 6th of September, so certainty is important. Now, postponing the elections could reduce the risk of infection and also relieve the pressure on the public hospital system. So this is in line with public interest. And also, by postponing the election for a year, we could avoid disrupting the legislative council cycle and the election cycle. And also, it will avoid invoking the wrong ordinances, which may lead to judicial legal challenge and therefore more uncertainties. It may also affect our governance. Now, the Court of Appeal made a ruling in relation to the Emergency Regulations Ordinance in April 2020. That ruling had to do with our regulation on the banning of masks. The court ruled that invoking the ordinances is constitutional. It will allow the Chief Executive and Council to respond swiftly and effectively to any emergency or public danger. Now we are now in an emergency situation. Now, I will give you some details about the emergency regulations on this, but the Secretary will give you more details.
Major provisions in the emergency date of general election 7th term of LegCo regulation. The new LegCo election date will be the 5th of September 2021, and all specifications relating to the 6th September 2020 as the date of the LegCo general election is revoked, bringing the electoral process to an end. We're going to publish in the Gazette today so that it will come into effect on the at midnight on the 1st of August. Electoral officers will still need to fulfill certain responsibilities election-related expenses and documents for public inspection. The Secretary will further elaborate on it in a moment. But this is not the end of the matter. There is still a rather thorny issue, and that is the Basic Law. Article 69 of the Basic Law provides that the term of office of the LegCo of Hong Kong SAR shall be 4 years, except the first term, which shall be 2 years. That means for this term of LegCo, it should come to an end on the 30th of September. In order to make it constitutional, we can postpone the LegCo general election by 1 year, but we won't be able to deal with the upcoming vacuum. Because if we invoke the Emergency Regulations Ordinance to allow operation of the LegCo, this may be in conflict with Article 69 of the Basic Law, which provides that the term shall be 4 years only and not 1 additional year. In order to provide the legal basis for this operation, I have submitted an urgent report to the Central People's Government for support and direction. The State Council replied and expressed support for the decision made by the Chief Executive in Council in accordance with the law to postpone the election of the Legislative Council by 1 year on the grounds of public interest. And in light of the circumstances of Hong Kong, with respect to how we should deal with the 1 year postponement and the vacuum arising from it, the State Council have also urged the Hong Kong SAR government to deal with the relevant work relating to postponement of the 7th term LegCo general election. And that concludes my presentation. I will now invite the Secretary for Justice to elaborate on the details of the newly enacted legislation.